What would you say were the hot or controversial topics that came up while you were in the editor's chair, and how it could reflect the times, I guess?
At the time, people, during at least the early 2000s, the whole idea of built environment, climate change, and the impact on environmental health, those were, kind of fringe. But I see EHP providing the opportunity for expanded exposure and a broader definition of environmental health topics. I think EHP was important in that it got environmental health to the position where it should be. We are heavily impacted by our environment. By defining what our environment is in the broadest terms, I think that was one of the major contributions of EHP.
This is an age where there's increasing attention to diversity in all spheres of our world. And I think we saw in the time I was editor, increasing interest in community-based participatory research, methods on how to go about that, as well as how to report not only in the journal, but back to the community. Of course, one of the hot items that continues today is on climate change and systems for looking at how climate and health interface and interact. That was also reflected a general trend to taking a more systems approach to all of science, I think. We certainly saw that in the realm of toxicology, where we went from looking at one chemical and its risk to looking at families of chemicals, to developing computational toxicology and methods for screening large numbers of chemicals, to really confront today's world, which is much more complex, and how much we also changed in our processes with the internet and electronic submission and peer review. So I think what was super important during this time was to have as broad as possible a base of associate editors. And we saw, enormous changes in the science of environmental science. And I think increasing public interest in it with endocrine disruptors, with climate change, that translated again into how important the news was, as the other speakers have talked about, the focus articles and the science selections that made this new knowledge and new way of thinking understandable to the general public, or the informed public. And I think I took the most pride in saying that we published really reliable research in an age of the internet where there's a lot of false knowledge floating around out there.
One of the early issues we dealt with was actually dioxins, when we had I think it was issue 4 or 5 that we came out with, and I think it was 1974. That was shortly after we learned that dioxins and furans were contaminants of Agent Orange in Vietnam, and were causing a lot of the problems that some veterans are still having now. And it was we tried to get folks together who had knowledge about the dioxins and say what they knew, what the knowledge gaps were, and stuff like that. And I think that issue in itself, that conference we had, led to an awful lot of research on dioxins and chlorinated toxins down the road. And I thought that was quite influential. The same thing could be said of one of our issues on the phthalate acid esters, which were again leached out of medical products and plastic materials and stuff through its use as a plasticizer. I think we did an awful lot with covering the scientific aspects of benzene, in vitro tests for genetic toxicity, what were the battery of tests you would need. And it's really out of that grew the short-term tests for toxicity as an alternative models to the using whole animals and things like that. And later on, we're getting involved with the children's health issues and some of the importance of oncogenes and mechanisms of cancer. And Ken mentioned, and Ken was certainly one of the leaders in the field of endocrine disruptors. And I think the journal became a well-respected vehicle for scientific information in all those areas.
Or I still think of was one of the biggest controversial things was involving pulmonary and respiratory toxicology. Obviously, an area that you know quite well, and so it was. There was, you know, these cigarette smoke and areas, things like that were somewhat coming out still in a, you know, back and forth debate. I just remember that mainly because it was not really my field. So I was having to rely when certain decisions came up.
One of the challenge, I think, in terms of getting good papers around climate change has been that, you know, a lot of the work that's being done is either on the atmospheric science climate side or on the adaptation side, and the amount that we can kind of really look at in terms of the impact on health of climate has been challenged and only ends up presenting in a sort of a few narrow ways. So getting them, you know, getting the big picture of climate and health and being a go-to journal in that area has proven to be more challenging than we thought.